Tate, Vice President of Sales for MGIS. Welcome to this segment of The Real Deal. This is where we take off the gloves, cut to the bottom line, and talk about real-life experiences of physicians and how insurance decisions affect their professional and often their personal lives. Today's topic, claims paid versus claims made professional liability coverage. With me today is Miss No-Nonsense herself, Molly Farrell, Vice President of Operations for MGIS Underwriting Managers. Molly, I'm going to go in reverse order here, and rather than define claims paid versus claims made, let's cut to the chase. The burning question really is, who cares?
Randy, here's why it really matters, because this could happen to any doctor. It's already happened to a doctor we currently insure. The doctor was covered on a claims paid policy. He was a hospital-based infectious disease specialist who treated a patient with a mitral valve prolapse. Another physician discharged the patient, and despite the fact that the physician was convinced that his treatment met the standard of care and the literature backed him up, that case was settled without his consent. Now the doctor has to live with the consequences. In fact, every time he looks on the web, every place he looks, it shows that he has a medical malpractice settlement. He couldn't leave while the claim was pending because the coverage provider had him on that claims paid policy. So he had to stay until the case was resolved. The doctor basically has no choice once a claim occurs. It's sort of like the old Eagles song, the Hotel California. You can check in, but there's no way you can leave. Conversely, if you look at a claims made policy, you have to be there when the case is reported. Once you've reported it, the carrier's on notice and you can leave.
So Molly, what are the key differences between claims paid and claims made that physicians should really be watching for?
Okay, Randy, here are 3 things they need to pay attention to. One I've already mentioned, and that is that the physician has to stay with the coverage provider until the claim is resolved or paid. Secondly, the physician is not the driver of his or her own choices. If you can't leave because of an open claim, you end up paying many more dollars for coverage than necessary. And most importantly, the physician doesn't truly control the outcome of a claim. Usually there's some committee that makes the final decision, and yet that individual physician, they live with the consequences of that decision.
So how does a physician best avoid these issues when selecting MPL coverage?
Well, Randy, the first thing they need to do is get a professional insurance broker. The broker represents them, not any one of the insurance companies or coverage providers. Then they need to make sure that the broker provides the physician with a detailed coverage comparison, letting them know what they're going to get from any coverage provider or insurance company. And finally, and most important of all, they need to ask their broker to define for them whether they are insured with a true insurance company, a risk retention group, or a trust. In essence, what type of coverage do you have? What are your rights under that policy? And what are you going to have to live with if things don't go your way?
That's it for today. Thank you for joining Miss No-Nonsense and I for this segment of The Real Deal.